We left off here looking at the mechanism of transport in the autonomic nervous system. And I encourage you to make a study table really regarding the different aspects of those receptors, the various affinities for their neurotransmitter, their different locations, so what tissues they're on. And so it's really important to think about that aspect of the receptors. But what we're going to move on to speak about today is really the mechanism. So how those receptors work differently, how they have different players involved in their signaling system, how they have different second messenger, different amplifier enzymes, and how they, so sort of correlating that to how they're located on different tissues and how they bring about different functions. Okay, so we're starting here looking at the alpha-1 receptor. So if we can sort of backtrack here and remember, we have alpha receptors, alpha-1, alpha-2 receptors, and that we've got beta receptors, beta-1, beta-2, beta-3. The alpha-1 receptors specifically, these are the only class of receptors that have this mechanism that we're going to speak about. They're very different from all the other receptors. They don't use the same amplifier enzyme. They don't use the same second messenger, The general idea of the signaling transduction is the same, but there are different players involved, and that's what we're going to speak about here. So the alpha-1 receptors basically are using PIP2 as their second messenger, right? PIP2 is this enzyme that's going to be involved here. So let's start out with what would happen when norepinephrine binds to one of these receptors. And remember, these receptors are usually found on vascular smooth muscle. They are metabotropic, right? They're going to be coupled to a G protein. This will be a G stimulatory protein. Really important to make that note. We're going to talk about some other mechanisms that involve a G inhibitory protein. So that small s, that sub s that we're seeing here represents that this G protein is a stimulatory G protein. When that neurotransmitter binds to the receptor, the G protein is going to be stimulated to float downstream in the membrane and do certain things. So we've got the alpha subunit here that dissociates off. It's going to activate an amplifier enzyme, right? The amplifier enzyme that we spoke generally or loosely about previously is phospholipase C here, specific to alpha-1 receptors. So this will activate phospholipase C, and what our amplifier enzyme does is it creates our second messenger, okay? It's going to create our second messenger that's going to go into the cell and start doing different things that will bring about our cellular response. And just to remind ourselves here, the metabotropic receptors don't bring about that rapid instant response that we saw with our ionotropic receptors. These have several different players, kind of like a relay race, right? Passing the baton, passing the signal from one player to the other. So phospholipase C being the specific name of our amplifier enzyme here, and lipase here meaning that it's going to cleave or cut something to activate it. And that's exactly what it does. It's going to cleave PIP2, and PIP2 stands for phosphatidylinositol bisphosphate, right? Really fancy word, which we can just from here on call PIP2. And PIP2 is then going to be cleaved into IP3 and DAG. IP3 being inositol triphosphate and DAG, diacylglycerol. And so phospholipase C creates these two second messenger, and they're going to go into the cell and help to bring about our cellular response. The two things that they will do inside the cell are release calcium. So calcium is typically stored in the endoplasmic reticulum. It's one of our intracellular organelles that stores calcium. And it's going to stimulate the release of calcium from the ER, and then that'll be one form of this response. Now, we're not going to get into the details of these responses here, but our focus is really on the players that help to bring about this response. But we know that eventually the response can be some type of ion channel opening up and the flux of some type of ion, and then that will help with our cellular depolarization, etc. The other aspect of the second messenger action is going to be activating protein kinase C, which will phosphorylate some type of protein. Remember, kinases are one of our modulators that can turn things on and off. And so it's going to phosphorylate, in other words, add a phosphate group to some protein in our cell. And that'll be another form of bringing about cellular response. So let's just sort of walk ourselves through these events. So we start with norepinephrine or epinephrine binding to our alpha-1 receptor. And you can sort of put alpha-1 here in your notes just to remind yourselves this is only the mechanism for alpha-1 receptors. They are coupled to a G-stimulatory protein. When that binds, the alpha subunit of that protein dissociates off, floats away from the receptor, goes downstream in the membrane, and is going to activate our second messenger. Activate our amplifier enzyme. Our amplifier enzyme in this specific example is phospholipase C. Phospholipase C will then create our second messenger, and it does so by cleaving PIP2. PIP2 is usually in the membrane, sort of chilling out. It'll cleave PIP2 once we activate the amplifier enzyme. It'll cleave PIP2 into IP3 and DAG, and they will enter the cell and help generate our cellular response. So IP3 and DAG are considered our second messengers because they're the ones going into the cell and bringing about the response. So what they will do is either release calcium from the ER. That'll be one way of generating a response. We'll see in example, smooth muscle cells, calcium release is what brings about smooth muscle contraction. So that will help this muscle to contract, right? Releasing calcium from the ER. But then it can also bring about cellular response by activating protein kinase C in the cell, phosphorylating some other X protein, and then that will be another mechanism of generating cellular response. Okay. So that was alpha-1, sort of one example of the mechanisms that are involved in these receptors, these adrenergic receptors. The other 4 adrenergic receptors use a different amplifier enzyme and a different second messenger, but they get a little bit more complex because they have different actions on their amplifier enzyme, different actions on their second messenger, okay? Let's start by looking at the alpha-2 receptors, which for simplicity, they're showing this all in the schematic in one frame, but we want to understand that these receptors are found on different cells, so it's impossible to have all of them acting in one area, but for the simplicity of this, we're showing it all in one image, right, in one schematic here. So norepinephrine or epinephrine binds to our alpha-2 receptor, again, usually on vascular smooth muscle as well. This is now coupled to a G inhibitory protein, okay? And what this will do is it will block the activation of adenylate cyclase. So while we'll talk about the beta receptors activating this process, alpha-2 is actually blocking this entire series or sequence of events. So because this is an inhibitory protein, it is actually blocking the alpha subunit from activating adenylate cyclase, which is involved here, which is preventing the production of cyclic AMP, which is preventing protein kinase from phosphorylating the protein, but that is the cellular response. Really important to understand that although it's blocking all of these steps, it's not preventing the cellular response. That is the ideal cellular response, to block those second messenger, to block that activation of protein kinase, to block the phosphorylation of the protein, and that is the desired response, right, for alpha-2 cells. On the other hand, we've got beta receptors, and this goes for all 3 of our beta receptors. Again, for simplicity's sake, we're drawing it here in one easy frame, but these are all on different tissues: beta-1, heart and kidneys; beta-2, lungs; beta-3, adipose tissue, right? Beta receptors are coupled to a G-stimulatory protein. Okay, so when we bind norepinephrine or epinephrine to a beta-2 receptor, it's going to activate this process. Same sequence of events, but now because it's a stimulatory protein, we're actually stimulating these events. So the alpha subunit comes off, it activates our amplifier enzyme, which is adenylate cyclase. That is going to result in the production of cyclic AMP. That is then going to turn on protein kinase such that it can phosphorylate a protein in our cell and bring about our cellular response, okay? Now, I also want to make a note here that while all 3 beta receptors stimulate their second messenger, Beta 2 specifically, that stimulation brings about an inhibitory response at the tissue level. And this is often an area that students are sometimes perplexed about. But although it's stimulating, beta 2 specifically has an inhibitory effect on its tissue that is brought about by stimulating its amplifier enzyme, by stimulating its second messenger. So let's kind of walk through these events here again for repetition's sake. So we've got an alpha-2 receptor here. Norepinephrine binds to that. It activates the coupled G protein, which is an inhibitory protein. And so because this is inhibitory, we're not going to see these events. It's going to inhibit the subunit from dissociating off. It's going to inhibit adenylate cyclase from being activated. It's going to then, let's scroll down here. It's going to then inhibit the following steps from happening, but that will be the desired cellular response, okay? Let's go back. So now we think about beta receptors. Norepinephrine or epinephrine binds to a beta receptor. We activate our stimulatory G protein that's coupled here. The alpha subunit dissociates off. We activate adenylate cyclase here. Adenylate cyclase will then create our second messenger, cyclic AMP, which will go into the cell and do the things that are required to bring about our response. That is turn on protein kinase, which will phosphorylate a protein in the cell. And the reason that we're just saying a protein is because this will be a different protein in every location. It'll be a different protein in heart muscle. It'll be a different protein in the kidneys. It'll be a different protein in fat cells, et cetera, et cetera. Okay, so we're just going to leave it at phosphorylate X protein, and that will generate cellular response. Okay. All right. So really important to understand that the big takeaway messages here: alpha-1 receptors use entirely different players. Alpha-2 receptors and all three beta receptors use entirely different players as well. However, among that, alpha-2 is doing something different to those players than all three of the beta receptors, right? Alpha-2 inhibits those players. Beta-1, beta-2, beta-3 activates these players, which are adenylate cyclase and cyclic AMP. So here is what a sample of that study tool that I encourage you to create would look like. It's going to have all your receptors listed. It's going to have what they're doing to their effector tissue, right, where they're located. Not what they're doing, excuse me, where they're located rather. So alpha-1, vascular smooth muscle, alpha-2, usually also on vascular smooth muscle, but on different locations though, right? Different types of vascular smooth muscle, and other places as well, central nervous system, platelets, etc. Beta-1 on kidney, on heart muscle, beta-2 on the respiratory tract. The uterus is another example, also seen on some blood vessels. So we talked about the ones that are going to skeletal muscles or to the heart. So if you're fighting or fleeing, you're in that sympathetic response. You want most of your blood vessels to contract or constrict, but there are a few exceptions where you want blood vessels to dilate to bring more blood, right? The ones that are going to your skeletal muscles so that you can run away, the ones that are going to your heart so that you can increase your heart rate and your contractility of the heart muscle, etc. And then beta-2 is usually only found on adipose tissue or fat cells, okay? We also want to think about what their relative affinities are, right? Alpha receptors prefer norepinephrine, beta-2 receptors prefer epinephrine, and then beta-1 and beta-3 have no preference, right? It's equal affinity. We also want to think about what they are doing to their second messenger. How are they influencing the second messenger in that signal transduction that we just talked about? So alpha-1 is activating IP3. That's the second messenger. IP3 and DAG, right? You can also add DAG here. Those are the second messengers that are being activated. Alpha-2 is going to be inhibiting its second messenger, which is cyclic AMP. Beta-1, beta-2, and beta-3 are all activating their second messenger, also cyclic AMP. And then lastly, you want to think about what they're doing to their effector tissue. How are they influencing that tissue? Are they exciting that tissue or are they inhibiting the tissue? And all of the receptors, alpha-1, alpha-2, beta-1, and beta-3, all of them accepting beta-2 excite their tissues. And you know, sometimes students have a hard time understanding what excite means. Excite means that you're going to stimulate the tissue to either contract or to decrease the diameter. And usually this is on vascular smooth muscle. So we're thinking about things like vasoconstriction, which is decreasing the size of that lumen, so less blood moves through, or causing the muscles here to contract, which helps to do that. Whereas beta-2 is the only example that we talked about that is actually inhibiting its tissue, it's inhibiting its effector organ. And because of the location of beta-2 receptors, some blood vessels, specifically ones that are going to muscle, ones that are going to heart, respiratory tract, right, as well as the uterus, we want to inhibit the response of the smooth muscle here. We want to inhibit the response of the tissues here. This is going to help in that sympathetic function for these specific locations. And the example I gave last time was if you're running from a bear, you want more air coming into your respiratory tract. So you want to relax or inhibit the smooth muscle that's lining your respiratory tract to facilitate more air coming in. You want to dilate the vessels that are going to your heart and muscle as opposed to constrict, okay? So it's really important to understand that while it's activating its second messenger, that winds up being an inhibitory response on the tissues, whereas while alpha-2 is inhibiting its second messenger, that is still constituting an excitatory response on the tissue. Okay, and then this table is sort of a nice summary table. It's just showing you some common medications that we use to treat everyday symptoms and diseases or disorders, and how they are actually leveraging our understanding of the autonomic nervous system. So for example, we think about isoproterenol. Isoproterenol is a beta-1, beta-2 blocker. This is going to be used in bronchodilation for asthmatics. So because it's going to agonize beta-2 effect, in other words, going to help inhibit those tissues, we can use that understanding to help with that response. And asthmatics usually have a lot of bronchoconstriction. They have really tight airways, really hard for them to get air in. And so leveraging our understanding of the autonomic nervous system, we can give them a medication that's going to agonize or act like or potentiate the beta-2 response. And that'll be, giving some relief to asthmatics. Another example is pilocarpine. Pilocarpine is usually used to treat glaucoma, dry mouth, dry eyes. And we, again, think about agonizing the response of the autonomic nervous system. So we want to think about increasing those secretions, which is a part of the parasympathetic response. And so we give these patients with dry mouth and dry eyes sometimes pilocarpine, and that will help them increase their glandular secretions, okay? But we also want to think about antagonists. So we can also use that power of our understanding of the autonomic nervous system to block certain effects, right? So for example, we think about prazosin, right? Prazosin is an alpha-1 antagonist. It's going to be used to treat hypertension. We want to prevent that vasoconstriction because alpha-1 receptors are associated with vasoconstriction. That's going to further potentiate hypertension or increase blood pressure. And so we want to block that alpha-1 effect and cause vasodilation so that these symptoms can be alleviated. All right. And I'm not going to test you on this, but it's just interesting to know how some of the common medications that I'm sure you've heard of or seen about can leverage our understanding of the autonomic nervous system. Scopolamine is another good one. This is what's given to people who have motion sickness or seasickness. If you're traveling on a boat, usually sometimes by air, you will take this, and this can leverage that muscarinic response, which is preventing nausea, preventing basically overexcitation of the GI system, which is what causes motion sickness when we travel.